Dear colleague, the case you bring to our attention gives us much to consider. Look at the biometry. The head is at the 44th percentile, the cerebellum at the 28th percentile, the abdomen at the 34th, and the femurs are very small with those long bone structures below the first percentile. Let's observe the head. What do you see? You see a head with regular ossification. You see a head with normal morphology. You see a normal cerebellum. You see a normal cisterna magna. You see a regular endocranial morphology. You see a normal nuchal fold, and we'll come back to that, and you'll see that at the level of the face there are no problems, and at the level of the orbital cavities there are no problems. This is because when you look at a fetus, you have to check everything to make sure there isn't a cataract. But look, you clearly see a regular spine, and above all else, you see a normal abdomen, and you see a stomach that is in its proper place. Let's carefully measure the abdomen as precisely as possible. Thank you very much. And here you can see that the biometric delay of the abdomen is not very significant. Let's go back to the spine. Let's return to the central trunk of the body, and you should observe a well-proportioned abdomen and a robust chest without encountering a funnel chest, without perceiving a narrow chest, without witnessing the abdomen excessively prevailing over the chest, ensuring a balanced and healthy appearance. You will check all the abdominal structures. You have seen 2 perfect kidneys. Now we are getting much closer to the main and most important part. Let's look closely at the thigh. Take the precise measurement of the thigh. Then measure the femur, and you will find a very small femur. You see there is a significant discrepancy of more than 3 full weeks. So, let's immediately go back to carefully look at the face, and you will clearly see that there is a perfectly normal nose. You see that there is no nasal hypoplasia. You see that there is no saddle nose. You see that there is no flat profile. You see that there is no micrognathia. Let's look again at the chest and see that there is no funnel-shaped appearance to the chest. You see the column which is regularly ossified, but you still have to see everything. Also look at the ductus venosus. It's there. It has nothing to do with it, but you have to check everything. After seeing this, let's focus on the main part. You see this extremely short femur. This is the thigh. Go immediately to check if the thigh is redundant. It's not redundant. And this is important because in cases of dwarfism, the thigh is often either too thin or especially too redundant. Take measurements of all the structures. This is the tibia. The morphology is normal, but it is extremely small. Check the morphology of the fibula. It's normal, but it's extremely small, but already observed carefully. Right after the deficits, there are some bright spots. And these will be the original considerations in this case. You see that the foot is normal, or at least it's not extremely small. We should then go back to carefully look at the head and meticulously check the cephalic index to determine if there's any indication of brachycephaly. But no, in this particular case it is clearly mesocephaly. Here it is mesocephalic. This is important. You need to have all the parameters to be able to help the geneticist, who is the real protagonist in this case. It's not us. It is the geneticist who has to figure out which of the more than 400 bone dysplasias it is. But this is the main moment when you need to pay attention. Look at the femur, look at the diaphysis. I'll write it down for you. I'll show it to you. And what do you see? You see above the diaphysis and specifically above the metaphysis, there are clearly visible ossified nuclei. So in essence, there is early and significant ossification of the metaphyseal structure, present both in the upper and also the lower portions. You can clearly see it, those specific areas, and you'll notice this finding in the humerus as well. And what does this indeed tell you? That there is precisely premature metaphysical ossification, which is what then leads to dwarfism in these cases. The most common pathology that causes this is chondroplasia. But we didn't find the characteristic head, we didn't find the small nose, we didn't find the distinctive brachycephalic head, we didn't find the small nose. But does this truly mean anything significant? No, because skeletal diseases often have an enormous expressive variability, and you should never ever assume. Make a diagnosis with ultrasound, but only with genetics. You can also see early metaphyseal ossification in the humerus. Okay, and also look at the ulna and the radius, because each one can give you information. The ulna and the radius are present, and they are also small, though a little less severely than the limb structures, which were at the first percentile. Here they are at the fourth percentile, but it doesn't make a difference. Remember, the hand can give you so much information. So go and take a look at it. Take your time, see if there is any brachydactyly. Here, there is only a clinodactyly of the fifth finger, which is a trivial thing, and the hallmark sign of achondroplasia, which is the trident hand, is not present. But I repeat for the umpteenth time, you cannot rely on its absence to allow yourself to make a diagnosis. The diagnosis is solely and exclusively genetic, so you need to request a genetic consultation, a karyotype study, and a panel study for bone dysplasias. And here I show you the hand again, both hands. You see them, you see that there is no polydactyly. You have to report everything, and this allows you to do a detailed examination and to help the geneticist, who will then complete the assessment. They will carry out the karyotype study, so you need to recommend this. Genetics also check that there isn't a marginal insertion of the cord and make sure there isn't an abnormal placenta. Finish the exam by observing other brain structures via the vaginal route. You see a normal corpus callosum. I hope this was helpful. This lesson is for our professional growth, and I thank you for your attention.